If you have had certain types of irregular heartbeat in the past but now have a normal heart rhythm, your doctor may prescribe Dronedarone Tablet to help keep your heart rhythm normal and lower your chance of having to go to the hospital for atrial fibrillation. It is known as an antiarrhythmic drug. However, it should not be used if you have permanent atrial fibrillation because of the increased risk of very serious side effects. Be sure to follow your doctor's instructions carefully and take the medication at the same time each day for the best results. Before you start taking Dronedarone, make sure to read the medication guide provided by your pharmacist and ask your doctor or pharmacist if you have any questions. Take this medication by mouth with food as directed by your doctor, usually twice daily, once with your morning meal and once with your evening meal. Remember to avoid eating grapefruit or drinking grapefruit juice while using this medication unless your doctor or pharmacist says it's safe. Grapefruit can increase the chance of side effects with this medicine. It's important to take this medication regularly to get the most benefit from it. Take it at the same times each day to help you remember. Don't stop taking Dronedarone without asking your doctor first, even if you feel well. Your doctor may also direct you to take another medication to lower the risk of serious blood clots, so be sure to follow their instructions carefully. If your heartbeat or pulse becomes fast or irregular, seek medical help right away. If you experience nausea or diarrhea, make sure to tell your doctor right away. It's important to remember that the benefits of this medication outweigh the potential side effects for most people. However, it's important to watch out for any signs of serious side effects, such as symptoms of liver disease, lung problems, or kidney problems. If you experience a fast or irregular heartbeat, severe dizziness, fainting, or signs of a serious allergic reaction, seek medical help immediately. And remember, if you notice any other effects that are not listed here, be sure to contact your doctor or pharmacist. If you have severe heart failure that makes you short of breath during light activity or even while resting, or if you recently had to stay in a hospital because your heart failure got worse, do not take this medication. Also, do not take this medication if you have a certain kind of irregular heartbeat, permanent atrial fibrillation, that will not or cannot be changed back to a normal heart rhythm. Dronedarone may increase your risk of death, stroke, or the need to be treated in the hospital for heart failure if you have any of these conditions. Consult your doctor for more details and to discuss the risks and benefits of Dronedarone. Tell your doctor right away if you have new or worsening symptoms of heart failure such as shortness of breath, swelling ankles/feet, unusual tiredness, unusual/sudden weight gain. Before taking Dronedarone, it's important to let your doctor know if you have any allergies or if you have a history of certain heart conditions. This medication may cause a condition that affects the heart rhythm, so it's essential to inform your doctor about any other medications you are taking and any medical conditions you have. It's also important to discuss with your doctor about any surgery you may have planned and to inform your doctor if you are pregnant or planning to become pregnant. Dronedarone should not be used during pregnancy, and women should use reliable forms of birth control during treatment and for 5 days after the last dose. For breastfeeding mothers, it's important to consult with your doctor before using this medication, as it is not recommended to breastfeed while using Dronedarone and for 5 days after the last dose. Older adults may be more sensitive to the side effects of this drug, especially QT prolongation. Talk to your doctor about using Dronedarone safely, and always follow your doctor's instructions regarding this medication. When taking Dronedarone tablets, it's important to be aware of potential drug interactions. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. There are several medications that may interact with Dronedarone, affecting the heart rhythm and the removal of the drug from your body. It's important to be cautious when taking Dronedarone with other medications such as fingolimod, amiodarone, disopyramide, dofetilide, and many others. Additionally, Dronedarone can slow down the removal of other medications from your body, which may affect how they work. It's important to consult with your doctor to ensure that there are no potential interactions with other medications you may be taking. If someone has taken too much Dronedarone tablet and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help by calling 911 or a poison control center. In the U.S., residents can call their local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. It's important to not share this medication with others. Your doctor may also require you to undergo lab and/or medical tests like EKG, kidney/liver function, and blood mineral levels including potassium while you are taking this medication. Make sure to keep all medical and lab appointments and consult your doctor for more details. If you forget to take a dose, just wait until your next scheduled dose. Don't take extra to make up for the missed one. When it comes to storing Dronedarone tablet, it's important to keep it at room temperature, away from light and moisture. Avoid storing it in the bathroom and always keep it out of reach of children and pets. When it comes to getting rid of this medication, don't flush it down the toilet or pour it into a drain unless specifically instructed to do so. Make sure to properly discard the product and it's expired or no longer needed, and consult your pharmacist or local waste disposal company for the best way to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.